Right. Good morning. Good morning, Sherry. How are you doing?
Good morning. I'm doing well. How are you, Dr. Sewell?
Very good. Good. I'm really happy to have this discussion with you, Sherry. I mean, this is something in my mind and probably in the mind of many people because of this COVID pandemic that hit our community really hard here in Chicago. And I wanted to talk about things that we usually don't talk about, which is how the healthcare disparity have been heightened because of the COVID pandemic. And I know that there were many media reports about this issue, but still, I think is not filtering to the community. How did the COVID pandemic affect the people of color, the Latino community, the African American community, Native Americans more than the white Americans? And why is that? Why is it that, for example, that the life expectancy of average American went down by 1 year, but African American by 3 years because of the pandemic, and Latino American by 2 years. So that's many lives lost unnecessarily, but there's a huge difference between 1 year drop in life expectancy, which is also big, and 3 years a drop of life expectancy. And there are many studies that showed that African American, for example, although they represent 30% of the residents in Chicago, they died in higher proportion than white American. Maybe 40% of the death, or even more, in Chicago were African American. But before that, if you want to introduce yourself, you're the vice president for nursing in St. Anthony's Hospital, which is in the southwest side of Chicago. What else people need to know about you?
Well, I am the chief nursing officer at St. Anthony Hospital in Chicago. It is a safety net hospital caring for the population you mentioned, African Americans and Latinos. So that is what I do day to day. I am an advanced practice nurse with gerontology being my focus. And I've been in nursing now for over 20, almost 25 years. So ICU as a background, telemetry medicine when I practiced on the floor. So that's about me.
Amazing.
Yeah.
And nursing is one of the most noble, of course, professions, but also one of the most difficult professions, especially when we have a disaster or pandemic where you have patients who are very sick, especially in the intensive care unit, and also they're more likely that they can spread the disease to frontline workers. So when we talk about frontline healthcare workers, what comes to mind always nurses. They're the first one who interact with the patients. They're the one who spend more time with the patients than others. They're the one who have to deal with the families, with the difficult situation. They have a large list of things that they have to do with the patient every day, and it's been tough on nurses in the last year or so. Um,
It's been
why,
extremely.
why do you think that we don't talk about nurses that much on and the impact of the pandemic on nurses?
Dr. Salul, we are frontline and we are partners in care with the physician. We are working side by side. Nurses are putting in a tremendous amount of hours and care. Or we're not only caring for the patients, but we have to care for the family as well. COVID has been described as a very lonely disease because the patients are not able to get regular visits, and we're not, as clinicians, in the room as we would in any normal circumstance. We would spend more face time with the patients, but with this disease and the limitations, we're not spending as much time. So it is a very lonely disease. We have seen more deaths during this pandemic than I've seen in my entire career. So we're dealing with the psychosocial aspect of this disease as well as clinicians. Seeing patients come in young and otherwise healthy and not surviving the disease has been very difficult for the nursing team. We build relationships with these patients and their families, and to not have a good outcome has been extremely devastating. And to also lose nurses who were frontline workers, for them to get stricken with this illness and not make it has been extremely difficult for us.
Yeah, I mean, I witnessed that every day, and the impact of the pandemic on nurses and respiratory therapists, secretaries in the ICU, physicians, and other healthcare workers. And it's been hard, and my deep condolences for everyone who lost a family member to the pandemic. How did our community in the southwest side of Chicago, where St. Anthony's are situated, has been hit with the pandemic compared to other communities? If you want to describe the impact of the pandemic on the neighborhood, um, how did it hit it?
So we were described as a hot zone within a hot zone, which means that our numbers were disproportionately higher than other communities. Again, we care for Latinos, Spanish speaking um, population, and African Americans. Historically, these two communities have not been the best in caring for chronic illnesses. So when the pandemic hit, they were hit most hard. They have admitted, and we did do studies on the types of patients we were seeing, the age, their social history, and what we discovered that a lot of the population had underlying issues that were not being managed. Um, there was a fear of coming into the healthcare system because a lot of the population we care for, they're undocumented. So there was a fear of immigration if they enter the healthcare system. So they waited a lot longer. They some came in 2 weeks after first symptom, and by that time, we were already behind in care. So it was a very difficult, extremely difficult time in the heart when this pandemic first hit, because we were seeing people coming in and they weren't making it. The outcomes weren't good. We did have good outcomes, but it would have been better if the population seeked help sooner rather than later. So it was very difficult.
So part of the issues that heightened basically this healthcare disparity, because let's be frank, in Chicago is very segregated city, and if you happen to live in certain neighborhoods, your access to let's say tertiary healthcare is not as good as other neighborhoods. So also you may have to work for essential work, because even with the pandemic, even with the lockdown, because you want to maintain your livelihood, and you cannot afford to stay at home and work through Zoom and meetings and so forth. um, and also there's many misconceptions and misinformation and disinformation are spreaded within communities of color, that makes it difficult for them, first of all, to believe that this is a pandemic that is really different than influenza, and that they need to seek attention. There's all kind of stigmata and taboos if you are infected, and you tell people that you are infected, so people hide it until it's too late, and so forth. So what else? I mean, why did this pandemic heighten the disparity, healthcare disparity in Chicago and in the nation overall? I mean, I mentioned that there's a disproportionate number of deaths among African American, among Latinos, among Native Americans, and also the fact that the life expectancy dropped much higher in the African American Latino community compared to white. Why is it? People ask this question.
That's a great question. So, again, as I mentioned, this is a population that has chronic illnesses, wasn't following up as they should. Um, not having access to health care, no, underinsured or not insured, not trusting the healthcare system. I've heard that, um, especially from the African American community, because there's been a long history of African Americans not trusting healthcare, going back to the Tuskegee um, trial.
Yeah.
So those things are still plaguing our community. So there's a trust factor as well that needs to be built or rebuilt between the African American community and the medical system. We saw disparity in distribution of supplies compared to the larger hospitals. They had more vents, we did not. It appeared that we had to fight, beg, ask for help in many ways to get the needed supplies we needed. Although we're in a big metropolitan city, it is very segregated, and you see it. We're down the street from Northwestern or U of I, and they did not have the struggles that we faced in the heart of the pandemic. We had to be very innovative. I remember running out of bleach wipes and
Mm.
having to create our own bleach wipes in order to um, continue to care for this population. And they were the sickest of the sick.
I mean, that's horrifying. I mean, as a physician, of course, that witnessed this, and I was in the midst of this. And my group and myself, we provide coverage to several hospitals in the Chicago region, and I've seen it. You know, this disparity of healthcare between a hospital that has plenty of nurses, for example,
Mhm.
for every patient. So at the peak of pandemic, one of the hospital that we provide coverage had two nurses per patient. And in St. Anthony's, where we had a huge shortage of nurses, that we had one nurse taking care of two or three or even sometimes four patients, when we had many nurses who got infected with the COVID, and we lost them for a few weeks or longer sometimes. And then we had the sometimes the policies that were counterproductive, where the cities opened McCormick Place and tried to hire nurses. They pay them more than what other hospitals are paying, and that also caused more shortages and backfired on many hospitals, including ours. Many of the hospitals that we go to had no problem whatsoever in ventilators. We had shortage of ventilators, we had shortage of oxygen, we had shortage of BiPAP, and all kind of things, including PPEs. So this is terrible. In Chicago, which is one of the largest cities in the United States, and one of the most developed cities in terms of healthcare in the universe, that we are talking about issues like this in the 21st century. And it's not fair. Um, by the way, the Tuskegee um, uh, experiment, which you've mentioned, for people who do not know, this is research that were done by the federal government in, I think, Alabama, and
Mhm.
injecting African American with the syphilis, and trying to see what's the impact of syphilis on their health. And that was in the 1950s or so. So
Yes. So
it's
not so
not
long.
that far, and it was terrible, and they were not treated, and that left this scar of lack of trust with the federal government or the system in general. So when I speak with some of my patients who are African American, they don't believe sometimes what the government is telling them or what people of authority is telling them because of this heritage. Um,
Correct.
so, I mean, we're talking about safety net hospital. What's really safety net hospital? And should we have safety net hospital in Chicago or in the United States in the 21st century?
Oh, wow. That is a hot topic, Dr. Salul. Safety net hospitals are absolutely needed. Safety net hospitals are community based hospitals that rely on federal dollars, mostly caring for underserved population. in neighborhoods that is needed the most. Um, if safety net hospitals are not around, who is going to care for this population? We will then create healthcare deserts. It's already a population that um, is suffering in so many ways. They live in areas where it's food deserts, where they don't have fresh meats, fresh fruits and vegetables. They're eating processed canned foods because that's what they have access to. Taking away a neighborhood hospital that's caring for the neighbors and has cared for generations, grandmothers, grandfathers, moms, and now caring for the children and grandchildren. You get to know the families, you get to know their plight. Um, you learn their culture and try to integrate their culture into their care. You have Hispanic families that typically eat a high carb diet, high fat diet, and this patient is dealing with heart disease and diabetes. And because you understand the culture and what the food means to the culture, you integrate their culture into their prescribed treatment plan or diet. So it's really getting to know the community and fitting into the community and providing the needed care. The larger hospitals oftentimes don't have a high number of public aid or uninsured patients. They're not providing that
or even undocumented
or
immigrants.
undocumented, exactly.
Mhm.
So safety net hospitals, community-based hospitals are needed.
It doesn't mean that we have to compromise medical quality, right?
Absolutely, absolutely not. There are clinicians that I know, you included, Dr. Salul, nurses that have dedicated their lives to caring for the underserved. And they choose to be at places like St. Anthony. Extremely intelligent, talented clinicians that have chosen to dedicate their lives to serving the poor.
So how come that there's not much or there's no this pouring of resources to safety net hospital if they are providing this crucial service to our communities? I mean, in the last year, as last 2 years, there were huge awareness or resurgence of awareness of disparity in general, systemic racism because of the murder of George Floyd. Um, but it was not translated so far, as far as I know, into more resources to organizations or hospitals like ours that is caring for the same community of George Floyd and also other communities. So, how do you explain that?
You know, that another great point. We saw the uprising of Black Lives Matter and other awareness to bring awareness to the disparity that we see on a daily basis in the African American community. And then you top that with police violence and the deaths that we saw in 2020. And suddenly we have this pandemic, and it becomes glaring that communities of color did not have the same privilege as other communities. So not only are we seeing socially the disparities, but now we're seeing it's very prominent in healthcare. And COVID brought that to light. We were able to see it firsthand that hospitals a few blocks away that served a different population, a more affluent population, had the necessary supplies. You just said it. We there were nurses, two nurses caring for one, whereas in my hospital we sometimes are at a 1-to-4 ratio of very sick patients. So that's just to tell you the difference and the struggles that we face. But although we face these struggles, we're still providing quality care to the community. We still ensure that we're providing safe care to the community. So it is a struggle.
Would you say that COVID overwhelmed our hospital?
Absolutely. It pushed us to a, a brink. It really did. We had to find innovative ways to provide care for the patients outside of the ICU. We had to set up ventilator system, going to the city, asking for more vents, creating high flows, different ways to get um, patients oxygenated. So we really were pushed to the brink, but it also brought out innovations from different clinicians and different people in the hospital. If we didn't have the supplies, we found a way to make it and make it happen.
Yeah, I mean, I wrote an article about this actually, and I happen to go to medical trips in war zones and in fragile states like Syria and Yemen and Sudan and Bangladesh and Colombia, and we sometimes teach this course on dealing with limited resources, which I believe that it is a must to teach to our medical students here in the U.S. because there is no country or hospital that has unlimited resources. We always have limited resources. So how do you prepare? How do you conserve? How do you reuse? How do you reallocate? How do you adapt to pandemics and disasters? It should be one of the courses that are taught and practiced every day in our hospital. And we did all of that in San Anthony's hospital, and I hope that we can learn lessons from that for the future, so we can be more resilient dealing with other disasters, which will happen.
It
Pandemic
will.
happens every 10 years. I remember the H1N1 influenza, which happened also 10 years ago, and it hit also our community really hard with younger patients dying because of H1N1 influenza. So you mentioned the shortages. So can you highlight these shortages and how is that different than other hospitals? What are the main shortages in our hospital that were surfaced because of COVID?
So, as we mentioned before, we saw a shortage immediately with vents. Um, as we know, COVID hits the pulmonary system, and a lot of the patients require support for oxygenation. So, when the patients, I remember one Friday night, it had to have been about 8:30. I was still at the hospital, and I received a call from the emergency department saying we're down to just one vent. We only have one vent in house. All the vents were being used that we had. And I remember calling my colleague and saying, I never want to be in a situation where I have to choose who gets the last vent. And I remember it hit me like a ton of bricks that, oh my God, this is the ethical dilemma that I never thought I would face in my career or my generation. And here I am facing it in 2020. That should not be in the United States in a big city.
Yeah,
It one of the most profound yet terrifying moment that Friday night, thinking we would have to choose who got a vent. And I just thank God that it didn't come to that, but it could easily have come to that on any given day. So the shortage of the vents was huge. In the beginning, there was shortage of PPEs, and again, we became innovative. We worked with infection control, and we had reusable gowns because we were running out of things like gowns. We were running out of gloves. We were running out of masks. So we had to be innovative, and we worked closely with infection control and came up with some innovative ideas on how to preserve what we had because there was no guarantee we were going to get more.
it's these stories are painful. I mean, I remember a few years ago, and this is from Syria, where there was a chemical weapon attack in 2013. One of the physicians who was uh, leading a hospital that was small hospital had 20 beds and they had two ventilators in a small town near Damascus. Suddenly he had an influx of 700 patients all of
Wow.
them suffocating because of exposure to sarin gas. And he had to choose which patient that he could save and which patient that he could not. By the end of the night, he had 140 patients who died on
Oh
him.
God.
So these things terrible and leave scars on physicians and administrators. So how do you deal with this? How do you stay more resilient? How do you prevent trauma to you and to the medical staff, to the nurses?
Well, that is that point really hits home. In the heart of the pandemic, we had a trailer. It was a freezer to store the bodies. On
I think we
average,
still have it, isn't it, in the parking lot, or this is different?
no, we had it removed.
Oh, okay.
And it was more for our psychosocial benefit to have it removed. But I remember that truck being parked in the parking lot, and I would park my car and have to walk past it to get to the door to get into the building. And every morning I had this feeling of doom, like, oh my God, are we going to add another body to the trailer? And who's praying for these people in the trailer? And I didn't realize until we saw our first COVID patient in March of 20. And I didn't realize how this was affecting me mentally. I became, I think, more depressed. I saw that in the nurses as well. Nurses crying a lot. Um, Wanting to not have to deal with it, but couldn't give up because the population was relying on us to provide care. But it was very difficult. It was a dark time. And the trailer played a big impact. It impacted all of us because people started talking to say that this trailer, it's so depressing. We went, average death for a year at St. Anthony would be 5 patients, and that was a high number compared to now 100 patient dying. That's staggering. It was very difficult, and it still is. It's almost as if we have gone to war and we're on our way home, but all of what we've gone through hasn't been addressed, and it does need to be addressed. It's post-traumatic stress. When you hear the overhead announcement for a code, it almost shakes you because we've heard that announcement way too many times during this pandemic.
Yeah, I mean, I remember in one day we had 3 patients who died because of COVID. They've been in the hospital for a long time, and they had multiple problems because of being on the ventilator and several infections. But it's tough. It's tough on everyone. One of the things that we've done in Med Global, and this is an organization that cares about healthcare disparity in the U.S. and at the global level. And we have several physicians from San Antonio's who are part of Med Global, including Dr. Hina Ibrahim and Dr. Alfredo Minalora, is to provide some support to hospitals like ours. So for people who care about Safety Net Hospital, they can donate to our local programs, and that will be translated into filling some of the gaps that we have at St. Anthony's, whether it's ultrasound or PPEs or even salaries for nurses and other things that will save lives. What do you want, and we can end on this, the public and the policymakers to know about our hospital? How can they help us and so that way we translate that can be translated into policies or support that can save more lives in our community?
Well, thank you so much for allowing me to be on this platform. Thank you. And thanks to all the people that are listening. Um, how we could use support, as you mentioned, for needed supplies, ventilators, because the fight still continues. Although our COVID numbers are lower, these are still necessary equipment that we need just to care for the community. Nursing salaries. St. Anthony nurses, on average, they make lower. It truly is a commitment to community nursing when you are a nurse at St. Anthony, because compared to other hospitals, the salary for a nurse at St. Anthony is about 25% lower. So even money to support nursing salary will keep nurses at the bedside. Oftentimes they want to stay and help in the community, but because they have families and other expenses, student loans, they choose to go to the larger institution. So, whatever help, supplies, equipment, nursing salaries, that would be greatly appreciated. And Med Global has given to us. You guys have given us ventilators, ultrasound machine. I mean, you name it, you guys have been so instrumental in helping us during the pandemic. You've donated money. So, thank you.
That's our duty, and I think also our policymakers should pay more attention to St. Anthony's and similar safety net hospitals. It is not fair that we live in a city that people have different access or no access to healthcare or to different type of healthcare just because they live in certain neighborhoods. So I think there should be more attention by the congressmen, by the congresswoman, by the senators, the mayor of Chicago to St. Anthony's, and so we don't have these shortages when the next pandemic will hit, hopefully. But thank you very much, Sherry, for sharing
Absolutely.
your views
Thank
on this issue.
you.
I hope that you have a beautiful weekend and
You well.
be,
Thank you.
be
Thank
safe
you.
and healthy. Thank you.
Bye bye.